Turning to page 40 of the calendar, House Joint Resolution 40, directing the Joint Legislative Audit and Review Commission to study Medicaid-funded transportation services in the Commonwealth. Report of the Committee on Rules with a substitute. And, Mr. Speaker, there are several floor amendments.
Gentleman from Fairfax, Mr. Albo.
Mr. Speaker, members of the House, may I ask the clerk of the floor amendments drawn to the substitute or the substitute? Okay, may I ask that first we adopt the substitute before I explain it?
Questions on adoption of the committee substitutes. May I favor that motion will say aye.
Mr. Speaker.
Gentleman from Charlottesville, Mr. Toscano.
Mr. Speaker, in reviewing the substitute and comparing it to the original bill, have a point of order related to the germaneness of the bill and whether it also may violate Rule 37. The initial bill talked about a study related to Medicaid funded non-emergency transportation services in the Commonwealth. In other words, a pretty narrow study. The substitute, however, is extremely broad, and it is involving an audit of the entire Virginia Medicaid program. It is both much broader than the original bill, and it also is changing pretty dramatically the nature of the study, and for that reason I ask if it is properly before the body.
Excellent question. Gentlemen, care to? Despite the eloquent position put forward by the gentleman from Charlottesville, I'm going to rule that the amendment is germane. Both the substitute and the original bill deal simply with Medicaid issues and how we can make them more effective and less costly. And I think that the language of the substitute is going to permit the House to properly investigate and propose constructive, efficient answers to best serve the citizens of the Commonwealth. So the substitute is before us.
Mr. Speaker, point of order.
Gentleman, stated.
Thank you, Mr. Speaker, and thank you for your explanation. But I'm looking at Rule 37. Doesn't it also require unanimous consent of the members of the House if there is any amendment? And if as long as one person objects, then it's not germane and not properly before the body?
Right. That would be true if the gentleman were, if the substitute were creating a study that the original wasn't dealing with, but the original is a study, and this is just adding to that study.
Thank you, Mr. Speaker.
Have we adopted the substitute? Questions on adoption of the committee substitutes. May favor that motion will say aye. Aye. Those opposed, no. No. Substitutes agreed to. Clerk will report floor amendments.
Mr. Speaker.
The gentleman from Charlottesville, Mr.
Yes, Mr. Speaker, a parliamentary inquiry, please. First of all, let me apologize to the body. When we tried to draft these amendments and tried to put them on IHOD, they didn't come on right away, and so we had to scurry around at the last minute. I think they're all before you now, but they're reported out in a way that's different than it originally had been intended. Originally, the floor amendment 2 was supposed to be number 1, floor amendment 3 was supposed to be number 2, and then floor amendment 1 was supposed to be number 3. So I'd ask that the clerk be able to report floor amendment number 2 as the first amendment be considered by the body.
Yeah,
in the order of the lines.
yes,
Yes.
we have that.
Thank you.
Floor amendment offered to the committee substitute by Delegate Toscano, line 21, after parentheses PPACA parentheses, strike the remainder of line 21 through % on line 22.
Gentleman from Charlottesville.
Yes, Mr. Speaker, speaking to the amendment, I think it's really very, very important, because this is a very important resolution, that we get it right. And so when I looked at this and I looked at the allegations that are set forth in the whereas clauses, I thought that it would be appropriate to strike that last section in lines 21 through lines 23, because it's not clear. There are some real questions about whether or not there is going to be substantial cost to the Commonwealth through the efforts to provide some coverage to those folks who presently do not have it. As you may recall, the administration came forward with some new budget projections based on their discussions with PricewaterhouseCoopers and also some historical data on indigent care in the Commonwealth. And they project actually that there is a positive number by the end of 2021. And so I'd ask that the body vote to strike this section of the resolution.
The gentleman from Augusta, Mr. Landis.
Mr. Speaker, speaking to that amendment.
Gentleman has the floor.
Mr. Speaker, and ladies and gentlemen of the House, and hopefully at some point we'll get a chance to explain the amended resolution. But what the gentleman is saying is that apparently some of these whereas clause he is saying are no longer accurate. I would say, Mr. Speaker and ladies and gentlemen of the House, part of the problem with the whole issue is the numbers keep changing. We think and still think that there will be substantial costs to the Commonwealth of Virginia, even at the 90% level with the reimbursement from the federal government if Virginia were to expand. So that I think figure would not necessarily be inaccurate the way I read it. And I would hope that we would not support the amendment.
Shall the floor amendment offered by the gentleman from Charlottesville, Mr. Toscano, be agreed to? As many as favor that motion will say aye. Aye. Those opposed, no. No. That amendment is rejected. Clerk will report the next amendment.
Amendment number 2 offered to the committee substitute by Delegate Toscano, line 23. Strike all of lines 23 and 24.
Gentleman from Charlottesville, Mr. Toscano.
Yes, Mr. Speaker, this is another one where I think this one is clearly wrong. I guess maybe you could say it's technically right, but it really gives the wrong impression. Mr. Speaker, ladies and gentlemen of the House, for those of us who have been following this very, very closely, that we are aware that when Oregon put in their Medicaid expansion, they began a study of ER usage by those people in the aftermath of getting the coverage. And in fact, here is the study report. And the study report has been seized by a number of people as evidence that putting people on Medicaid does not reduce emergency room admissions. In fact, it increases them, at least according to this. But as always, there is a rest of the story. And if you take a look at the updated study of the Oregon experiment, which was reported just 2 days ago in the Oregon Press, the Oregon health plan reforms are preventing costly hospital care. Here are the findings. And they're related to reforms that Oregon is putting in place, particularly as to do with managed care, which is exactly what we have been doing in Virginia for the last several years, and we are continuing to do in Virginia. This says for the first 9 months of the Coordinated Care Organization's performance in 2013, emergency visits and spending are down. Primary care visits are up. Spending, hospital readmissions are down. Emergency department visits by people served by these coordinated care organizations has decreased 13% from the 2011 baseline data. Those are real numbers. Why should we clutter up a resolution that purports to represent it being real numbers when in fact the data is different. The new data shows that these folks are not using emergency rooms as often and readmissions are down. So for that, I hope that you can strike this clause because it does not represent the story. Thank you.
Mr. Speaker. Thank you, Mr. Speaker. Mr. Speaker and ladies and gentlemen of the House, the gentleman's correct that the original study showed that there was potentially a 40% increase with the emergency room related issue. There is some dispute whether that figure is accurate. Some hospitals still show that there is potentially an increase, but the study that the gentleman mentioned from Oregon did show that they actually had a decrease. So, Mr. Speaker, I would say that the gentleman's amendment in this case does no harm and would be fine to strike those two lines.
Shall the floor amendment offered by the gentleman from Charlottesville, Mr. Toscano, be agreed to? As many as favor that motion will say aye. Aye. Those opposed, no? No. The amendment is agreed to. Clerk will report the third floor amendment.
Mr. Speaker.
Gentleman from Manassas.
Parliamentary inquiry.
Stated.
Just want to confirm that the amendment passed in that last.
That's what I thought. Sounded like it to me.
We have division, Mr. Speaker.
I beg your pardon?
Can we have division?
Sure. Somebody needs to call for it.
Call for division.
Many as favor adoption of the amendment will raise their right hand. The amendment is agreed to. Some people weren't paying attention. Clerk will report third floor amendment.
Third floor amendment to the committee substitute offered by Delegate Toscano, line 60, after the word performance, insert the word and, whereas it is in the interest of all Virginians to embrace continuous reform of Medicaid while enabling Virginians to gain insurance coverage that they do not presently have in the most cost-efficient way possible.
Gentleman from Charlottesville, Mr. Toscano.
Thank you, Mr. Speaker. I hope I have as good luck with this one as I had with the last one. Mr. Speaker, ladies and gentlemen of the House, I hope that you'll embrace this language. It's very carefully drawn to reflect what I think, at least I hope, that most of us want here, and that is reform and efficiency-driven ways to expand the coverage gap to more Virginians who do not have it at present. So I'd ask the body to approve the amendment.
Gentleman from Augusta, Mr. Landis.
Thank you, Mr. Speaker. Mr. Speaker, I think the gentleman's amendment is well intended, but I would say that the gentleman's amendment does not take in consideration the safety net that we have in the Commonwealth of Virginia, and that we do provide many individuals coverage through free clinics and the like. And Mr. Speaker, although I agree with the intent, I think he's excluding what we do provide in the safety net now, and therefore I don't think the amendment is necessary. And I would ask the House to not agree to the amendment.
The question before the House is the adoption of the amendment offered by the gentleman from Charlottesville, Mr. Toscano. As many as favor adoption of the floor amendment number 3 will say aye. Aye. Those opposed, no? No. That amendment is rejected. 1 out of 3. You're batting .333 in the National League. You make a lot of money. The gentleman from Henrico, Mr. Morrissey.
Thank you, Mr. Speaker. Point of parliamentary inquiry.
Let me state it.
Do Jefferson's rules not require that if a member of the body votes for an amendment to HJR, that they are then required to vote for passage?
My Jefferson's manual scholars say no. The gentleman like to explain the.
Mr. Speaker.
Gentleman from Augusta, Mr. Landis.
With the gentleman from Fairfax's permission, since it is his resolution, I just want to quickly explain the resolution. We've already talked about the whereases, so that hour's late, and I'm not going to take the House's time with that. You can read those, but I just want to point out, if you do look on page 2 of the resolution, there's some very important aspects of what we're asking for. What we're simply asking for is an audit, an outside audit of our Medicaid program. For those of us that have been working on the Medicaid issue for the last 6 months to a year, what we have found is, one, we have done many internal audits. We have done process audits. We have had JLARC look at specific areas of Medicaid, but there has never, ever been a complete audit, top to bottom, in looking at all the aspects, both programmatically and financial, of our Medicaid program. Those of us on MERC decided, in trying to come up with a resolution that we could put forward for the House that would provide something that would be of benefit to the continual work of the MERC, and more importantly, to help us find, from a financial standpoint and programmatic standpoint, how to make our Medicaid system better so it can serve more people, and more importantly, we can start look at how we're going to bend the cost curve for this item that is 22% of the Commonwealth's budget. Now, the resolution specifically, if you look at lines 65 through 67, deals with a number of items, and this is what we're trying to accomplish with the audit. We want to look at our current Medicaid audit process and how to improve it. We want to look at DMAS and the efforts they have been working on to identify and pursue third-party liability for Medicaid payments. We want to look at the implementation status of the recommendations made in the 2011 JLARC report and really look at that specifically. We want to review the fee-for-service system that covers our high-volume and high-cost Medicaid services. We want to review the long-term care program for the elderly and disabled, a very, very expensive population and part of Medicaid. And most importantly, we want JLARC to contract with an external auditor to conduct a complete financial audit and analysis of our Department of Medical Assistance Services. The reason we're having JLARC do this is because that will leave us some legislative oversight and control of this process. Even though they're contracting with an outside auditor, JLARC, which obviously has representatives from the House and the Senate and is a legislative commission, will be able to direct and make sure that the audit is accomplished in an efficient and cost-effective manner. There will be an item in the budget to cover the cost for the audit, so you can expect to see that when we release the House budget later on this month. Mr. Speaker and ladies and gentlemen of the House, I really hope, as we had in the Rules Committee, that we'll have bipartisan support for this measure to move us forward to come up with what the costs are and how we can improve our Medicaid system. We've heard all the debates of the reasons for expansion or not. And whether you're for expansion or you're not for expansion, you should still be for this resolution and for this audit. You all might recall that a prior administration told us several years ago, after many, many audits had been done, both internally and externally, within state government, for the Virginia Department of Transportation, that they were the most audited agency in the world. And some may argue that DMAS is the most audited agency in the world. But I would remind you, I would remind all of us that served in this body at that time, we came back in the first year of the McDonnell administration, the audit was accomplished, and $1.5 billion was found. Even if we get a small percentage of that $1.5 billion, we will have accomplished a great deal, not only financially in finding what savings there may be, but more importantly, what programmatic items we can do to accomplish in making our system better for our citizens who receive Medicaid services. And Mr. Speaker and ladies and gentlemen of the House, I hope you will pass the resolution.
The gentleman from Charlottesville, Mr. Toscano.
Mr. Speaker, will the gentleman yield for a quick question?
Will the gentleman yield?
Mr. Speaker, I yield.
Mr. Speaker, I'd ask the gentleman, some of us over here on this side are having a little heartburn with the language in the resolution that has to do with 2014 and then again November 30, 2015, and a worry, I think, frankly, that we have that this will be simply a way to delay. Can the gentleman assure me that at least he has an open mind to the possibility that we may be able to do something in a positive way to close the coverage gap in this budget cycle, even if we approve this?
Mr. Speaker, I would answer the gentleman this way. One, the reason that we have the 2014 deadline and for the interim report and coming back and the 2015 are two reasons. One, JLARC's workload. The reason we're having an outside audit is we don't think JLARC could do it just by themselves. It'd probably take them a longer period than that. But by contracting with an outside contractor, we do think that they can accomplish it in the 2 years fully. We do believe that we'll get some interim recommendations or ideas that will come back both financially and programmatically that we can use in this next year as the MERC continues its work. But I would say to the gentleman, if he means that coverage gap is Medicaid expansion, I would tell the gentleman that I am not in favor of Medicaid expansion, and I have never been in favor of Medicaid expansion and never will be.
Speaking of the bill.
Gentleman has the floor.
Thank you, Mr. Speaker. I thank the gentleman for his candid statement of his views about this, and I appreciate the passion with which he feels it. I might say that the problem over here really is not with an audit. Audits are great things. It's with the delay. And the delay is costing us $5 million a year. A day. I get it right eventually. This is not like an audit that was done for VDOT. The monies that come from the Medicaid system go in and they go out quickly. It's not like you have a lot of pots of money lying around the way you have with transportation projects that may take many years to engineer, plan, and then build. So it's not, if you think that an audit is going to find you a chunk of money that you can then use, I think you're sadly mistaken. The other thing I might want to point out is that these audits are not new. These books here, and I'll never be able to lift them, are audits. DMAS audits of the Medicaid program, 2008 to 2011. That's this book. This book is 2012 to 2013. This helmet is not mine and was not put, it was given to somebody next to me. It's not mine. And I don't intend to use it. For the last 10 years, there have been a total of 61 external audits. Audits from Governor McDonald. The last audit he did, he said after it was done that they did a terrific job. These are 23 audits by the Auditor of Public Accounts, 11 by the Centers for Medicare and Medicaid Expansion, 4 by a group subcontracted by KPMG, independent, and 3 by JLARC, by the way. So it's not like we haven't been auditing the system. If the gentleman had stated that this was not being used as a delay, then I think the inclination would be to vote for this because it's probably a good thing to do just to make sure. But it's our view that this should not be supported because all this is going to do is delay the reforms that we need to get moving on and delay the coverage that will help some 400,000 Virginians get better insurance and help our hospitals ride out financial problems that they're going to face in the next few years. I hope that you will reject the resolution.
The gentleman from Henrico, Mr. Morrissey.
Mr. Speaker, he answered my question.
Gentleman Henrico, Mr. Massey.
Speaking to the resolution, Mr. Speaker.
Gentleman has the floor.
Mr. Speaker, $9 billion a year. That's $25 million a day. That's what we spend in our Medicaid program. It is the largest line item in the state budget. The gentleman from my good friend from Charlottesville, Delegate Scano, talks about all the audits. All those audits, not one of them has been done exclusively a total comprehensive fiscal, financial, and operating audit of our Medicaid program. We cannot make a good decision about what to do with Medicaid without having an operating and a financial audit of Medicaid. It's just good business, Mr. Speaker. Therefore, I encourage every member of this House to support HJ 40. Thank you, Mr. Speaker.
Shall the resolution be adopted?
Mr. Speaker.
The gentleman from Shenandoah, Mr. Gilbert.
Parliamentary inquiry.
Gentleman may state it.
Mr. Speaker, I will yield to the gentleman from Augusta.
Gentleman from Augusta, Mr. Landis.
Mr. Speaker, can this resolution go by for the day?
Sure. Bye for the day. We don't have to talk about it again tomorrow, do we?